Hello, everyone. My name is Nario Cantu, and thank you for tuning in for the Friendly Pharmacist Podcast, starting now. Hi, everyone. I'm Nario Cantu, pharmacist and owner of Cantu's Pharmacy, and welcome back to the Friendly Pharmacist Podcast. Today, we're focusing on a topic that affects so many families, yet often doesn't get the attention it deserves: medication safety for seniors. As people age, their health needs become more complex, and managing multiple medications can become challenging. Issues like polypharmacy, drug interactions, fall risks, and confusion about dosing are more common than many people realize. Whether you're a senior yourself or a caregiver supporting a loved one, I want to share practical guidance to help make medication use safer, simpler, and more effective. Let's start with polypharmacy, which refers to taking multiple medications at the same time. It's not uncommon for older adults to take medications for blood pressure, diabetes, heart conditions, pain, sleep, and other issues, sometimes prescribed by different doctors. The more medications a person takes, the greater the risk of interactions, side effects, and accidental misuse. One of the most important things seniors can do is keep an updated list of all medications, prescriptions, over-the-counter products, vitamins, supplements, and share that list with every healthcare provider they see. Pharmacists play a crucial role here. We review these lists regularly, catch potential problems, and help streamline therapy when possible. Another major concern is drug interactions, which can be more dangerous for seniors because aging affects how the body processes medications. Kidneys and liver function gradually slow down, meaning drugs can stay in the body longer and build up to unsafe levels. Over-the-counter medications and supplements can also complicate things. Something as simple as adding ibuprofen for pain or a sleep aid at night can interact with existing prescriptions. This is why a pharmacist should always be part of the conversation. We're trained to identify these risks and help choose safer alternatives. Let's talk about fall risks, which are often linked to medications. Certain medications cause dizziness, drowsiness, or drops in blood pressure, especially blood pressure medications, anxiety medications, sleep aids, and opioids. For seniors, even a minor fall can lead to serious complications. If you or a loved one has experienced dizziness, trouble keeping balance, or unexplained fatigue, it might be related to medication. These are not signs to ignore. A pharmacist can help review which medications may be contributing and discuss options with your doctor to reduce the risk. Medication organization is another essential piece of safety. Seniors may struggle with remembering doses, opening bottles, or keeping track of changes. Pill organizers, blister packaging, medication synchronization, and reminder apps can make a huge difference. At Cantu's Pharmacy, we offer help with organizing medications, aligning refill schedules, and setting up systems that make daily routines easier and safer. Sometimes removing the stress of managing medications can dramatically improve a senior's quality of life. For caregivers, your role is incredibly important. You're often the first to notice changes in mood, appetite, sleep, or behavior, and these changes can be related to medication. If something seems off, speak up. Caregivers should also feel empowered to ask pharmacists questions, request medication reviews, and advocate for simpler, safer regimens. You don't need to be a medical expert. Partnering with a pharmacist ensures you have the support and knowledge you need. Finally, it's important to involve seniors in their own care as much as possible. Encourage open conversations about how they feel, whether they've experienced side effects, and whether they understand their medications. People are far more likely to take medications safely when they feel informed and supported, not overwhelmed or confused. Medication safety for seniors isn't just about preventing problems. It's about creating a system that allows older adults to thrive, stay independent, and maintain their dignity. As a pharmacist, I've seen how small adjustments can reduce risks and dramatically improve well-being. Whether it's reviewing medications, simplifying routines, or offering reassurance, we're here to make this journey safer and easier. Thank you for joining me on today's episode of the Friendly Pharmacist Podcast. I'm Nario Cantu, and I hope this conversation gives you clarity, confidence, and practical steps to support yourself or the seniors in your life. If you found this episode helpful, please follow, share, and stay tuned for more meaningful health discussions. Until next time, take care, stay safe, and remember that your pharmacist is always here to help.